welcome back to Breakfast Television. Thanks for starting your day. Minus 2 degrees. Now, Leah Sarich is joining us. 1 in 10 Canadians has kidney disease. Every day, 15 people are told that their kidneys have failed. So today is World Kidney Day, and this year the focus is on children. Our health specialist, Leah Sarich, with one's family's struggle with kidney disease and what we can all do to help.
Right. So, of course, this is devastating when we're talking about it in children, but we do want to raise some awareness. So in children, kidney disease is often hereditary or a defect that occurs before the baby's even born, where the kidneys really don't form properly. In adults, it's a much different disease because in adults, it's usually due to lifestyle problems or some other kind of illness, usually an autoimmune disease. But for both adults and children, kidney disease doesn't often produce symptoms until the kidneys are well into decline, functioning as low as about 20%. So patients don't really know they have kidney disease. So it's so much better to learn about kidney disease early on. So interventions can be taken to prevent or at least slow down the progression of the disease. So for the Kimmich family that I spoke to, their son Maximilian was diagnosed with a type of kidney disease called Alport syndrome when he was just 3 years old.
It was devastating for us because when you have a baby, you don't exactly expect this sort of news. And it took actually a very long period of time for us to find out because everyone kept thinking that he just had a urinary tract infection, like a recurrent infection. So when one doctor finally said, no, actually maybe it's something more, we started seeing the nephrologist. And so when we found out, it was devastating to find out that our son had it, and then we had already had our daughter, and then we found out I was a carrier and that she had it as well.
Can you imagine how devastating that is? So she has 2 children with kidney disease now, the Alport syndrome, and they went on and they have a 3rd child now, a brand new little baby. He's 7 months old, little Enoch. He is also now being tested for the disease, and he has about a 50-50 chance of getting it. They'll find out in May. So this is incredibly sad. Meantime, doctors are working very hard to preserve kidney function as best they can in the other 2 children. But it's mainly a boy's disease, but at least this family found out early on. So getting a diagnosis sooner rather than later is always better, though the disease, of course, is always challenging to live with, both emotionally and physically.
It's difficult. Mostly they're asymptomatic because even if they have decreased kidney function, they actually are not particularly unwell until their kidney function is down to, say, 20% or so of normal. But nowadays what we're trying to do is to identify these children earlier, and especially in the boys who are the ones that are most affected by decreased kidney function, we're trying to start them on medications which may slow the progress of the disease.
So as Dr. Midgley mentioned, Alport syndrome is mainly a disease of boys. It's eventually leading to decreased kidney function, eventually requiring dialysis and ultimately a kidney transplant. Dr. Midgley says some of these kids can end up on dialysis or requiring a transplant by the age of 10 or 15 years of age. So that's really early. The Kimmich family, of course, is hoping that by telling their story for Kidney Day, they can raise some awareness and create some donations, and of course that money going to research so they can maybe find at least some new treatments, maybe a cure one day. And that's really what we're doing here today on Kidney Day, is raising awareness. So, of course, more information on my blog, including links to the Kidney Association, kidney.ca, where you can make a donation.
The Kimmich family, very brave of them to
very
come forward
brave of them
with
to
a very
come forward.
personal story.
Absolutely.
We wish them all the best, and how you can donate at breakfasttelevision.ca. Thank you, Leah.
You're welcome.